Here's something most people don't find out until it's already a problem. You can lose up to 40% of the fibers in your optic nerve before you ever notice a single change in your vision. 40% gone. And you'd feel completely normal the whole time. That's not a scare tactic, that's just how certain eye conditions work, and it's exactly why so many people in their 60s, 70s, and 80s end up hearing devastating news at an eye exam that could have been caught years earlier. If you've ever thought my eyes are fine, I would know if something was wrong. Stay with me for the next few minutes, because that one assumption is exactly what allows some of the most common causes of vision loss in older adults to sneak past unnoticed. And later on, we're going to talk about a symptom that shows up as nothing more than a few floating specks, something almost everyone brushes off, that can actually be an emergency. So let's get into it. Why does this matter so much more once you pass 55 or 60? It's not because your eyes suddenly become fragile, it's because several very common eye conditions are age-related, slow-moving, and painless in their early stages. Painless and slow-moving sounds like it should be good news, but it's actually the opposite. Pain is your body's alarm system. When something doesn't hurt, we don't feel the urgency to get it checked. A toothache sends you to the dentist, a sore knee sends you to the doctor, but a slowly narrowing field of vision, or a slowly blurring center of sight, often doesn't announce itself at all until a big chunk of it is already affected. On top of that, our brains are remarkably good at compensating. If one eye starts to weaken, the stronger eye quietly picks up the slack, and you might not notice anything is different for months or even years. This isn't about frightening you. It's about understanding why regular eye exams matter more now than they did when you were 30, and why learning the early warning signs, even subtle ones, can genuinely protect your independence, your safety, and the things you love doing, whether that's reading, driving, gardening, or simply recognizing your grandchild's face across the room. Let's start with the change almost everyone experiences to some degree, because it's the most familiar one, and it sets the stage for understanding the others. Somewhere around your 40s, you may have noticed that reading a menu in a dim restaurant became a little harder. Maybe you started holding your phone a bit further away, or you found yourself asking someone to turn on a brighter light. This is called presbyopia, which simply means the natural lens inside your eye is gradually losing some of its flexibility. Think of the lens like a small, clear camera lens that used to zoom in and out easily. Over the decades, that lens stiffens, the same way a rubber band left in a drawer for years becomes less stretchy. This is not a disease. It's not a warning sign of anything serious. It's simply part of getting older, and reading glasses or bifocals handle it beautifully for most people. I'm mentioning it first because it's important to separate the normal, expected changes from the ones that need real attention, so you're not lying awake worrying about something that's actually harmless. But here's where it gets interesting, because right alongside this completely normal change, several other conditions can be developing quietly in the background, and they look nothing alike once you understand what to watch for. One of the most common of these is the clouding of the lens we just talked about, and when that clouding becomes significant, we call it a cataract. Picture looking through a window that's slowly gathering a thin film of fog. At first, you might not even notice because it happens so gradually. Colors might seem a little duller than they used to. Bright lights, especially oncoming headlights at night, might start to create a glare or a halo effect that makes night driving uncomfortable. You might find yourself needing brighter light to read comfortably, or noticing that your glasses prescription seems to need updating more often than it used to. Cataracts are incredibly common with age. Most people, if they live long enough, will develop some degree of lens clouding. The encouraging part of this story is that cataract surgery is one of the most successful and frequently performed procedures in modern medicine, and for most people, it restores clear vision remarkably well. But here's the piece that trips people up. Because cataracts develop so slowly, many people adjust without realizing how much they've lost. They just quietly stop driving at night, or they give up a hobby like needlework or woodworking without connecting it to their eyesight. If you've noticed yourself avoiding certain activities because the light's just not good enough anymore, that's worth mentioning to an eye doctor, because it might be less about the lighting in the room and more about a change happening inside your eye. Before we move on, let's picture this in a real-life situation, because it makes it much easier to remember. Imagine a woman named Carol, 71 years old, who used to love reading in her favorite armchair by the window every evening. Over the past year, she noticed she needed to turn on an extra lamp just to read comfortably, and the pages seemed to have lost a little of their contrast, like the print wasn't quite as crisp as it used to be. She assumed it was just her eyes tiring out after a long day. What she didn't realize was that this was a textbook description of early cataract changes, and by the time she finally mentioned it at her annual checkup, her doctor found cataracts in both eyes that were already moderately advanced. The good news for Carol, and for most people in this situation, is that the outcome was still excellent, because cataract surgery remains highly effective even at that stage. But her story is a perfect example of how these changes disguise themselves as simple tiredness or getting older, when they're actually something specific and treatable. Now here's where we get to a condition that genuinely deserves the nickname doctors have given it: the silent thief of sight. It's called glaucoma, and understanding it might be one of the most protective 5 minutes you spend all week. Inside your eye, there's a small amount of fluid that constantly drains and refreshes, kind of like a sink with the tap running and the drain open at the same time. In glaucoma, that drainage system gradually becomes less efficient. Fluid builds up, pressure inside the eye rises, and over time, that pressure damages the optic nerve, which is the cable carrying visual information from your eye to your brain. Here's the part that makes this so sneaky. Glaucoma typically starts by affecting your peripheral vision, the edges of what you see, not the center. Your brain is so good at filling in gaps that you can lose a surprising amount of side vision before you consciously notice anything different. People describe it, once it's more advanced, as looking through a tunnel, but by the time someone notices that tunnel effect, they've often already lost a significant portion of their vision permanently, because unlike some other eye conditions, damage from glaucoma generally cannot be reversed. This is exactly why eye doctors don't just ask you to read a chart during an exam. They also measure the pressure inside your eye and examine your optic nerve directly, because those are the tools that catch glaucoma long before you'd ever feel it yourself. If you have a family history of glaucoma, your risk is meaningfully higher, so that's worth mentioning to whoever does your next eye exam. Think about a man named Robert, 68 years old, who prided himself on his sharp eyesight his whole life. He never wore glasses, drove confidently at night, and assumed his vision would simply stay that way. During a routine exam, almost as an afterthought, his optometrist measured the pressure in his eyes and noticed it was higher than it should be. A follow-up test of his peripheral vision revealed a small blind spot near the edge of his sight in one eye, something Robert had never noticed on his own, because, as we mentioned, the brain fills in those gaps so smoothly. Robert didn't feel sick, he didn't have a headache, he didn't have any pain at all, but he had early glaucoma, and because it was caught at that stage, daily eye drops were enough to lower the pressure and protect the vision he had left. Had he skipped that appointment, or gone another 5 years without one, the story might have looked very different. This is really the heart of why glaucoma earns its nickname. It doesn't announce itself. It just quietly takes a little vision here, a little there, and by the time most people notice, a meaningful portion is already gone for good. Let's shift to a condition that affects the opposite part of your vision, from glaucoma, the center, rather than the edges. This one is called macular degeneration, and it involves a small but incredibly important part of your retina called the macula. The retina is the light-sensitive layer at the back of your eye, kind of like the film in an old camera or the sensor in a digital one, and the macula is the small central portion responsible for sharp, detailed vision, the kind you use for reading, recognizing faces, and seeing fine detail. When the macula deteriorates with age, it's called age-related macular degeneration, and it tends to show up in one of two ways. In the more common, slower-moving form, tiny deposits build up under the retina, and vision gradually becomes blurry or distorted in the center of your sight, while your peripheral vision usually stays intact. People sometimes describe straight lines, like a door frame or the edge of a window blind, appearing wavy or bent. In the less common but faster-moving form, abnormal blood vessels can grow underneath the retina and leak fluid, causing more sudden and serious vision loss. This is actually a great moment to mention one of the simplest home tests that eye doctors recommend for people in this age range. It's called an Amsler grid, and it's essentially a small checkerboard pattern you can look at periodically, covering one eye at a time to see if any of the lines appear wavy, blurry, or missing. It takes about 10 seconds, and it's something many eye doctors will give you to keep at home, precisely because catching changes early can make a real difference in treatment options. There's also been a lot of interest over the years in whether certain vitamin and mineral combinations can help slow the progression of macular degeneration once it's already present. Research studies, most notably a large trial often referred to as the AREDS2 study, found that a specific combination of antioxidants, zinc, and copper appeared to reduce the risk of progression in people who already had a moderate to advanced stage of the dry form of the disease. This is important to state carefully because it's not a cure, it doesn't reverse damage that's already occurred, and it's not something everyone needs. It's a targeted approach for a specific stage of the condition, and it should only be started after a conversation with your eye doctor, since the right formulation and the right candidate matter quite a bit. This is a great example of the difference between emerging research and something with strong, well-established evidence behind it. Regular eye exams remain the most well-established tool for both conditions, but it's worth knowing these more targeted options exist for the right situation. Family history plays a meaningful role in macular degeneration as well, similar to what we discussed with glaucoma. If a parent or sibling has been diagnosed with it, it's worth mentioning that to your own eye doctor, since it may affect how closely they choose to monitor your retina over time. And much like glaucoma, macular degeneration in its earlier stages often causes no pain and no dramatic symptoms, just that subtle blurring or waviness in your central vision that's easy to attribute to needing a new glasses prescription. There's another condition worth understanding, especially if you or someone you love has diabetes, because it connects two systems in the body that people don't always think of together, blood sugar and eyesight. It's called diabetic retinopathy, and it happens when consistently high blood sugar levels damage the tiny blood vessels feeding the retina. Those vessels can weaken, leak, or become blocked over time. In the early stages, there are usually no symptoms at all, which is exactly why the American Diabetes Association and eye care organizations recommend that anyone with diabetes get a dilated eye exam at least once a year, even if their vision feels perfectly normal. This is a great example of something we'll come back to later in this video. Some of the best protection against vision loss isn't really about your eyes at all. It's about managing your overall health. In this case, keeping blood sugar levels well controlled with the guidance of your doctor. Consider a man named Thomas, 64, who had lived with type 2 diabetes for almost 15 years, but had let his eye exams slide for the last 3 of them, mostly because life got busy and his vision felt fine. When he finally went in, his eye doctor found early signs of diabetic changes in the blood vessels of both retinas. Because it was caught before it affected his central vision, his medical team was able to work with him on tighter blood sugar management and closer monitoring, and his vision has remained stable since. Thomas often says now that he thought of his diabetes as something that affected his energy levels and his feet, and it genuinely surprised him to learn it was working quietly on his eyes the entire time too. This connection between blood sugar and blood vessels is exactly why diabetes management and eye health are really the same conversation, even though they don't always feel like it. There's one more everyday eye issue worth mentioning here, because it doesn't get nearly as much attention as the conditions we've already covered, even though it affects an enormous number of people as they get older. It's called dry eye, and it happens when your eyes either don't produce enough tears or don't produce the right quality of tears to stay properly lubricated. You might notice a scratchy, gritty feeling like there's sand in your eye, or oddly enough, you might notice your eyes watering excessively, which sounds like the opposite problem, but is often your eye's overcorrection response to dryness and irritation. Dry eye becomes more common with age, and it's even more common after menopause due to hormonal changes, as well as in people who take certain medications for blood pressure, allergies, or depression, since some of these can reduce tear production as a side effect. The good news is that dry eye, while uncomfortable, is rarely dangerous, and it responds well to simple treatments, ranging from over-the-counter artificial tears to prescription options and small lifestyle adjustments, like taking regular breaks during screen time and using a humidifier in dry indoor air. If your eyes have felt unusually irritated, tired, or blurry by the end of the day, and it's not been connected to any of the conditions we've talked about so far, dry eye is worth mentioning at your next appointment because relief is often much simpler than people expect. Before we move into the everyday habits that can help protect your vision, I want to talk about something a little different, because it's less about a specific disease and more about a set of symptoms that everyone, and I mean everyone watching this, should be able to recognize instantly. Remember that mention earlier about a few floating specks that could actually signal an emergency? Here it is. It's completely normal, especially as we age, to occasionally notice small specks, threads, or cobweb-like shapes drifting across your vision, particularly when looking at a plain, bright background like a clear sky or a white wall. These are called floaters, and in most cases, they're simply small clumps in the gel-like substance that fills the inside of your eye, and they're harmless. However, there's a very important distinction between ordinary, occasional floaters and a sudden change that needs immediate attention. If you experience a sudden increase in floaters, especially if it happens quickly, along with flashes of light that look like little lightning streaks at the edges of your vision, or if you notice a dark curtain or shadow creeping in from one side of your sight, these can be signs of a retinal tear or a retinal detachment, and this is considered a true eye emergency. The retina, remember, is that light-sensitive layer at the back of your eye, and if it tears or detaches from its normal position, it can lead to permanent vision loss if it isn't treated quickly, often within hours to a couple of days. The encouraging news is that when caught early, retinal detachment can often be successfully treated. The key word there is early. So, if this ever happens to you, a sudden shower of new floaters, flashes of light, or a shadow moving across your vision, this isn't a wait-and-see symptom. This is a same-day call to an eye doctor or an emergency room. Sudden vision loss in one eye, even if it seems to resolve on its own, deserves the same urgency because it can occasionally be a sign of a blood vessel blockage or even a warning sign related to stroke risk, and getting evaluated quickly is genuinely one of those situations where minutes and hours matter. It's worth taking a moment to separate this emergency from the more common, harmless floaters that most people notice from time to time. If you've had the same handful of small specks drifting lazily across your vision for months or years, and nothing about them has changed, that's typically just the normal, gradual thinning of the gel inside your eye that happens with age, and it's not something to worry about. The red flags are specifically about sudden change, a rapid increase in the number of floaters, new flashes of light that weren't there before, or any new blind spot or shadow. When in doubt, it never hurts to call an eye care provider and describe what you're experiencing. They would much rather answer a quick phone call that turns out to be nothing than have someone wait at home while a treatable retinal tear becomes a permanent detachment. Vision changes can also show up in ways that feel less like an eye problem and more like a driving problem, and this is worth addressing directly because it's an emotional topic for a lot of families. Difficulty judging distances at night, trouble seeing pedestrians or cyclists in low light, increased sensitivity to headlight glare, or feeling like you need to lean forward and squint to read road signs. These can all be early signs of the very conditions we've discussed today, particularly cataracts and certain stages of macular degeneration. Giving up night driving, or driving altogether, is never an easy conversation, but it's worth remembering that many of the conditions causing these difficulties are treatable, and getting evaluated might restore confidence behind the wheel rather than end it. An eye exam is a much better first step than simply avoiding the roads out of uncertainty. Now let's talk about what you can actually do, starting today, to give your eyes the best possible chance as the years go by. The first and honestly most important habit isn't a supplement or a special exercise. It's simply scheduling regular comprehensive eye exams, and specifically ones that include pupil dilation. Dilation means the doctor uses drops to temporarily widen your pupil, which lets them see much more of the retina and optic nerve than they could otherwise. This is the exam that catches glaucoma, macular degeneration, and diabetic changes long before you'd notice symptoms yourself. Most eye care organizations recommend a comprehensive dilated exam every 1 to 2 years for adults over 60, and more frequently if you have diabetes, high blood pressure, or a family history of eye disease. It might feel like a hassle to set aside an afternoon and deal with blurry, light-sensitive vision for a few hours afterward, but compare that small inconvenience to the alternative of losing vision you could have protected. Beyond regular exams, there's a surprisingly strong connection between your everyday habits and your long-term eye health. Managing blood pressure and blood sugar isn't just good for your heart, it directly protects the blood vessels feeding your retina. Not smoking, or quitting if you currently do, meaningfully lowers your risk of both macular degeneration and cataracts, because smoking increases oxidative stress throughout the body, including in the delicate tissues of your eyes. Wearing sunglasses that block UV rays isn't just about comfort on a bright day. Ultraviolet exposure over decades is one of the contributing factors in cataract development, so a good pair of sunglasses is genuinely a small, easy form of long-term protection. Diet plays a role too. Leafy green vegetables like spinach and kale, along with colorful vegetables like carrots and bell peppers, contain nutrients such as lutein and zeaxanthin that concentrate specifically in the macula and appear to offer some protective benefit. Fatty fish like salmon, rich in omega-3 fatty acids, has also been associated with better long-term eye health in several studies. None of these habits are guarantees, and I want to be honest with you about that, because nobody can promise you'll never develop an eye condition just by eating well or wearing sunglasses. But what the research does show fairly consistently is that these habits shift the odds meaningfully in your favor, and they're the kind of small, sustainable changes that also happen to be good for your heart, your brain, and your overall health at the same time. There's one more practical piece worth mentioning, and it's about your home environment rather than your body. As some of these age-related changes develop, even mild ones, good lighting becomes more important than people realize. Brighter task lighting for reading, non-slip mats in bathrooms where reduced depth perception can make a fall more likely, and simply keeping walkways clear of clutter can meaningfully reduce the risk of trips and falls that sometimes result from subtle vision changes people haven't fully noticed yet. This isn't about assuming something is wrong with your eyes. It's about recognizing that a well-lit, well-organized home is protective for everyone, and it becomes especially valuable as the decades add up. It's also worth saying a word about how often you should actually be getting these exams, because the honest answer is that it depends a bit on your personal risk factors, and a good eye doctor will help tailor that schedule to you. As a general guide, adults between 55 and 64 are often advised to have a comprehensive dilated exam every 1 to 2 years, while those over 65 are frequently advised to go annually, since the pace at which several of these conditions can develop tends to pick up in that stage of life. If you have diabetes, a personal or family history of glaucoma, or you've already been diagnosed with early cataracts or macular degeneration, your eye doctor may recommend checking in even more frequently than that. None of this needs to feel overwhelming. Once it's built into your routine, alongside things like an annual physical or a dental cleaning, it simply becomes another normal part of taking care of yourself. One more thing worth mentioning, because it comes up constantly in questions from viewers. Reading glasses you buy off a drugstore shelf are not the same thing as a real eye exam, and they can't catch any of the conditions we've talked about today. Those glasses only correct the basic focusing problem we described earlier with presbyopia. They say nothing about the pressure inside your eye, the health of your retina, or the condition of your optic nerve. If your only vision care in the last several years has been picking up a new pair of drugstore readers when the old ones stopped working well enough, that's a good sign. It's time to schedule an actual exam with an eye doctor, not because the reading glasses were a mistake, but because they were never designed to do the job a comprehensive exam does. So let's bring this all together. Some vision changes, like the need for reading glasses, are a completely normal part of aging, and nothing to worry about. Others, like cataracts, develop slowly and are highly treatable, often restoring vision beautifully when the time is right. Conditions like glaucoma and macular degeneration tend to be quiet in their early stages, which is exactly why regular dilated eye exams matter so much, because they can catch changes long before you'd feel them yourself. And then there are the true emergencies, a sudden shower of floaters, flashes of light, or a shadow across your vision, situations where getting checked the same day can be the difference between temporary concern and permanent vision loss. None of this is about living in fear of losing your sight. It's about giving yourself the information to notice changes early, ask the right questions, and get the right care at the right time. Because your eyes support so much of what makes daily life rich, from reading a good book to watching your grandchildren grow up to simply enjoying a sunset. If you take just one thing away from everything we've covered today, let it be this: your vision can be changing even when it feels completely fine, and the only reliable way to know for certain is a proper dilated exam with someone trained to look for it. Not a symptom checklist, not guessing based on how sharp your eyesight feels day to day, but an actual look inside your eye by someone who knows exactly what early warning signs look like. That single habit, repeated once a year or so, does more to protect your independence in your later decades than almost anything else we've discussed today. Pair it with the everyday habits, the blood pressure and blood sugar management, the sunglasses, the leafy greens, the good lighting at home, and you've built a genuinely strong foundation for protecting your sight for the years ahead. If any part of this surprised you, I'd genuinely love to hear about it in the comments below. Was it the fact about how much vision you can lose before ever noticing? Was it learning the difference between ordinary floaters and the kind that need urgent attention? Or maybe you already have some experience with one of these conditions and you'd be willing to share what you learned along the way. If you're comfortable, let us know roughly how old you are and what country you're watching from. It's always meaningful to see just how many different places this community reaches. And of course, if any of what you heard today sounds familiar or concerning, please don't wait. Reach out to your eye doctor and get it checked. As always, take care of yourselves, take care of your eyes, and I'll see you in the next video.